am Dr. Reema Sircar. I am an obstetrician, gynecologist and IVF specialist working as senior consultant with Indira IVF at the Allahabad branch. Friends, we're all amidst this corona pandemic and have been fighting it bravely for almost 4 months now. During these 4 months, our country and all of us endured a massive scale lockdown, which kind of put a stop on our respective lives. But we did it because it was important. Now, because of the uncertainty of the nature of the novel virus, the uncertainty regarding the duration of the pandemic, and the deteriorating economies, our leaders have now decided to face it head-on, and so currently we are in what we call unlock phase. Yes, I understand it's scary to know that we are on our own to face something that is deadly. But as a doctor, and as a doctor who's a mother, a wife and a daughter too, I urge you all, please follow the new normal protocol of social distancing, hand washing and wearing a mask whenever in public. Follow them like your religion. Scientists all over the world are brainstorming and are at the humongous task of finding a vaccine soon. We just have to stay put till then, take care of ourselves and each other, and I am positive that like all the bad times humanity has had to face, this virus too shall pass. Like everyone else, our infertile couples who were already under treatment or who were planning to start their fertility treatment, they have suffered too, with their treatments getting delayed. However, the good news is that whatever studies we have received so far from all over the world, the virus does not seem to significantly or differently affect the expecting mothers or the precious newborns. So just in case you are that one who's still in two minds about whether to go ahead with your fertility treatment or to withhold it, I would suggest you to text or call and speak to us at the number mentioned on the screen. Starting now with our session today, which is about ovarian cysts and their effects on the female fertility. Let's start with basics. Every woman has one uterus, 2 fallopian tubes and 2 ovaries, one on either side of the uterus. In simple words, ovaries are the banks where the women store their eggs. Every month, under the influence of hormones, a few of these eggs start increasing in size and one of these few will reach maturity and become available for fertilization. Now, sometimes what happens is that these eggs may not rupture, most commonly due to hormonal problems. Now, instead of rupturing, they may collect fluid inside them. They are then called follicular ovarian cysts or simple cysts. So, what are cysts? They are fluid-filled structures inside the ovary. These can be of two types: simple if the fluid inside is clear, or complex if the fluid that collects is not clear fluid. It could be blood, in which case they are called hemorrhagic cysts, or there could be solid areas inside along with the fluid. Or some patients keep bleeding into the closed spaces of ovary every month and form what are called endometriotic cysts. Sometimes pelvic infections can also lead to pus-filled collections. Another very common condition is called polycystic ovarian disease, which results due to the hormonal imbalance. Even some of our pregnant patients can have physiological cysts like corpus luteal cysts. While all of these are generally not cancerous, it is the cysts which have lots of solid areas inside that should need further evaluation. Simple cysts are quite common and usually do not produce any problems or symptoms. In fact, most of the times they are discovered as a chance finding during routine pelvic examination by a gynec or during an ultrasound done for some other problem. But sometimes they can produce problems like irregular periods or painful periods, pain in the lower back, thighs or lower side of the tummy. If they become very sized, for example 15, 18 centimeter or so on, they can press upon the surrounding structures like urinary bladder or intestines and can produce what we call as pressure symptoms. like difficulty in initiating urination or constipations. Sometimes if the cysts become very big and have a very thin pedicle, they can twist around this pedicle, sometimes even 2 to 3 twists, and can produce a very painful and serious condition called torsion of the cyst. This is an emergency and may require surgery too. So symptoms can really be variable from nothing at all to medical emergencies. How do you diagnose them? As I already mentioned, during a checkup by the gynec or by imaging like ultrasound, CT scan or MRI of the abdomen or pelvis. I often get asked if the cyst can cause difficulty to conceive. Well, the answer is yes. Some conditions like polycystic ovarian syndrome, which is associated with hormonal imbalance and resulting anovulation or immature eggs, or endometriotic cysts, which is a cause of painful periods, painful intercourse, are often associated with infertility. To know more about these conditions, you may connect with us by texting and requesting a call back at the number given on the screen. And a fertility expert will surely answer your query. So what is the treatment for the cyst? Well, it depends on a lot of factors like age of the patient or her fertility status, whether it is a peripubertal young girl or a woman in her reproductive age or a postmenopausal lady who has completed her family. Treatment will also depend upon the nature of the cyst, whether it is a simple or a complex cyst, and the symptoms it is producing. For example, a simple cyst that's not producing any symptoms in the patient can be managed by simple wait and watch policy. And more often than not, they resolve on their own in subsequent menses. Some of the larger and symptomatic cysts may need medical treatment in the form of hormonal preparations, which can sort of suppress the cyst. But in patients who are unable to conceive, for example in situations which result in immature and non-rupture of eggs like polycystic ovarian disease, these patients will need hormonal preparations to produce maturation and rupture of these eggs. These drugs are called ovulagens. They can be oral in tablet forms or they can be injectables. Such patients can conceive via intrauterine insemination or in vitro fertilization depending upon the status of their tubes and the husband's semen analysis. Similarly, patients of endometriotic cysts can have associated infertility and will fall into the category of moderate to severe endometriosis. While mild endometriosis can respond to milder form of treatments like ovulation induction and IUI, these severe forms will usually require in vitro fertilization to attain pregnancy. So all of such patients are advised to see a fertility expert as soon as they discover that they are having difficulty. Now there can be certain conditions like I already mentioned, like torsion of the cyst or a complex cyst. All of these cysts may require surgical removal too. I hope I was able to give a basic idea about the ovarian cyst through this session. However, if you still have any doubt or query on your mind, you may visit any of our Indira IVF center. All our 90 plus centers pan-India are fully operational with all the COVID protective robust protocols. Or you may even text or call on the toll-free number on the screen. With this, we end our session today. Take care and stay safe, friends. Thank you.